My name's Colleen Cebulla. I'm an ocular oncology and vitreoretinal specialist at Ohio State University, and I'm an assistant professor here. Well, I went to school for about 100 years to get here. Actually, I'm from Ohio originally, and after college, I went to Ohio State University College of Medicine for the combined MD-PhD program. So I had a very early interest in research and medicine. And from there, Paul Weber helped get me interested in ophthalmology. And so my ophthalmology interest took me to Miami, Florida, where I trained at Bascom Palmer Eye Institute for my residency. And then following that, I did vitreoretinal surgery tier fellowship, preceded by an ocular oncology fellowship. So I had a lot of training, and then I was very happy to come back to Ohio. I really wanted to be closer to family, and so I wound up back at Ohio State University. I'm a Buckeye. I'm originally from Ohio, and I think it's a great state. I really like Columbus. Like I said, I went to med school and grad school here in Columbus, and I really wanted to come back to this department because the collegiality here is just really unparalleled. The faculty are just so friendly and welcoming and supportive. I think the patient population is wonderful. And I also think that, in terms of the university, the resources here are unbelievable. I mean, this is a humongous university, very research focused, and so in terms of collaborations and just what's available to us here as faculty, it's fantastic. The hope is that with personalized medicine, we can sort of reduce some of the unnecessary treatments or potentially have better outcomes for patients if we know, certain types of patients are going to respond better with one type of treatment, whereas another type of patients maybe need a different kind of targeted therapy. So I think the goal is to have more of a targeted therapy that could potentially provide further benefits to patients in terms of outcomes. There's so many rewarding parts. I just love talking with patients, and especially when I've helped them through a tough problem. I think that's one of the most gratifying parts of my work. And sometimes they'll come here and they've been to several doctors and haven't gotten a clear answer of what's happening to them and how it can be helped. And so sometimes we're able to offer a new perspective and help with very complicated diseases. So I really like that a lot. I would say that in terms of what a patient can expect from me as their surgeon, they'll expect somebody who has very good training, who really cares about the patient and doesn't cut corners, and takes a lot of time with the patient. So I think they can expect a lot.